Hello, everybody. Welcome to this week. Welcome back, and hope you're ready to tackle a topic that we don't talk a lot about, and we should, and maybe not for the right reasons that we do, but we'll talk all about that today. So this week we're talking about men's health. How many of you were surprised to even see men's health as an issue on the syllabus? Probably quite a number of you. Men's health is not something that we usually think about or talk about. And that poses sort of my question for the week. Are men oversimplified and overlooked? What are the prevalent health challenges for men? Why do we do these sort of things, and what can we do about them? So first, when I say men's health, I often get people being like, tell me more. Men's health what? Maybe they go into sort of like, well, yeah, when we talk about like gay men or men of color or other sort of things. But no, I'm just talking about good old men's health. A lot of people are like, isn't that like just everybody's health? Isn't that just, we assume everybody's, standard is sort of like, the white man at the pinnacle of everything. And in a lot of ways we do that. But in a lot of ways, because the issue is health, we don't do that. So there's some history around men's health and sort of men's issues, right? We have women's studies programs. We have gender and sexuality programs. We have all sorts of different sort of things, but where's the men's health programs, or where's the the men's studies, right? Well, fun story. In the 60s, when we started to see sort of the revolutionizing of women's rights and women's liberation, queer rights and queer liberation, we started to see all these sort of not white hetero patriarchy sort of stuff. We had women's studies departments and women's health issues and all these other sort of things. And there were a lot of men who were like, hey, what about us? Because this is a typical sort of refrain of anytime we talk about women's issues or queer issues, whoever is not being talked about says like, hey, well, what about us? Which sometimes is reactionary, but sometimes is not necessarily a bad thing. Like, yeah, what about it? And so there were some men's studies and some men's health departments and programs and areas of study that opened up in the 70s and 80s as a reaction to sort of the opening up of these sort of things. And guess what? Nobody wanted to study those sort of things. Chico State, where I teach, primarily, we had a men's health class for quite some time, but it got really, really hard to fill it, and there was not a lot of people who were interested in taking it, and almost entirely all of the people who took men's health were women. Right? And so this is sort of the crux of the issue. How is men's health different than women's health? How do we focus on men's health, which isn't important because we do recognize that all human beings are important and valid, and we should care about everybody's health. But how do we do it in a way that doesn't take away from women's health or from sort of trans and non-binary sort of issues? Is there something that is to be said with this new sort of shifting of thinking about gender in a less binary sort of way, where we before always studied sort of men and women, and now we're like, yeah, but there's a lot more than that in gender, and maybe there is some ways to talk about a lot of different gendered experiences, and we don't have to necessarily separate them into men's and women's. Are there values in that? Well, there's a lot of questions, of course, that I'm asking, as I always do, and a lot of stuff that we'll talk about today and this week. So first, let's start off with sort of grounding ourselves sort of what does it look like to be a man in the world. We're going to use US statistics because they're the most readily available. And we can always start by saying, like, in the US, we have some of the best healthcare sort of standards. We know Europe has some better ones, but because most of us in this class, Americans, we're going to start from this sort of thing because it's what we're familiar with and what we know. And what we can say is that in other places that are not America, the likelihood of things being worse rather than better is probably pretty significant, at least in the developing world and in lesser developed countries, right? And so let's think about health insurance, right? Well, we already know health insurance is a mixed bag when it comes to a lot of sort of things, but it is a standard that which we measure and we look at these different sort of things. And so in the slides, I have a couple of different measures that we're going to talk about. The first one is people under the age of 65 without health insurance at the time of interview. We do under 65 because at 65, everyone is guaranteed health insurance because we have Medicare. Medicare is our socialized health program, which a lot of people fail to recognize or even reflect on, but we do have socialized medicine here in the US, but it's only for old people. Okay, so what we want to look at is for people under 65, who are the people who are uninsured? Well, not surprisingly, in some ways, men are the ones who are underinsured, mostly because we've seen a rise in women's programs. So whether it be WIC for pregnant and parenting women, whether it be through reproductive health related sort of stuff for women who are at risk of becoming pregnant or are pregnant themselves, get a lot of health coverage through those sort of mechanisms, where for men, we don't really need to worry about a lot of those sort of things. Men aren't carrying children. Men aren't going to become pregnant. And so they don't qualify for a lot of those sort of things. And so what we see is that men tend to go without health insurance in juxtaposition to women. However, one of the interesting things is if we start looking at a breakdown of sort of different kinds of insurance and these sort of things, when it comes to employer provided insurance, we see that men are way more likely to have insurance covered through their job than women are for any jobs. And so there are some weird sort of skews when we dial down in a little bit more, but in general, by and large, for people who are over the age of 18 and under the age of 65, sort of adulthood, men are way less likely to have health insurance coverage than women. Now let's look at physician visits. How often do you go to the doctor? And we look at it between sort of genders, between male and female. Again, knowing that that's not all the genders, but that's how we typically break things up. We can see that in sort of the under 18, which we think of as kids, we treat kids relatively all similar, and then old people, because we have that socialized Medicare process, relatively similar, right? But when we look at that 18 to 64 age, what we see is that women far outpace men in going to the doctor, right? Not surprising, since we just talked about, well, if men don't have insurance, why would they go to the doctor, right? Because we know doctors are expensive in the United States. Okay, that's part of the puzzle. Now, when we look at my next slide, talks about people who failed to obtain needed health care. Now, this is not elective stuff. This is not even preventative stuff. It's stuff that, like, you really needed to go to the doctor. You broke something, and break typically doesn't heal on its own. These other sort of things. And what we see is that women tend to go without getting medical care if it is absolutely necessary. They will say, well, you know what? Maybe my arm is broken, but I'll just wrap it up real tight and hopefully it feels better. Whereas men, when they really need to go to the doctor, they actually do go, right? And so that's a little bit of a difference, and we'll talk about some of those sort of things. Now let's talk about risk behaviors and things that put people at risk for health. If we look at drinking, so this next chart in the slides talks about one heavy drinking day in the past year. We know that binge drinking is a risk behavior. It leads to other sort of consequences, and people who binge drink tend to do it more than once a year, even though that's what this chart is asking for. And what we see shouldn't be surprising. Men far outpace women in terms of heavy binge drinking, right? Based on contemporary culture, that shouldn't be surprising to you. Cigarette smoking, right? Next slide in our set. Well, guess what? Men smoke more than women. Also not a surprise, and we'll talk a little bit more about that too. The next slide, when we just look at people who have been tested for HIV. Now, we would think HIV testing, that must be a measure of risk behavior, and actually it's not. People who are at risk for HIV is a different sort of thing than for people who get tested for HIV. People who are getting tested for HIV might be at risk, but they're also tend to be people who are proactive and looking at their health in different sort of ways. So it shouldn't surprise you that women get tested for HIV way more than men. Because women are the ones who tend to be proactive in going to the doctor's visits and all these other sort of things. Again, that childbearing pregnancy sort of angle, a lot of people are tested in relation to reproductive health care sort of stuff. Now let's look at a different sort of thing. So how about flu vaccines? In flu vaccines, who is going and getting flu vaccines? Guess what? Women, again, except for over 65. And over 65, again, Medicare does a great job of covering pretty much everybody. But in that 18 to 64 year range, women far outpace men in terms of flu vaccines, which is a protective behavior. Serious psychological distress is our next one. So who is experiencing serious psychological distress? This one is an interesting one because we see women far outpacing men in terms of serious psychological distress. However, this is reported, right? We know that women are far more likely to report mental health stress than men, regardless of whether or not they're actually experiencing it more, right? There is a lot more grace given to women saying like, hey, I'm depressed, or I'm anxious, or I have these other sort of things going on, where men are not given that sort of thing. And so it may look like women have more mental health problems, but it's actually that women report mental health problems much more so than men. The raw sort of statistics, we don't really know, but we do know that, biopsychosocial sort of stuff, men tend to have higher genetic markings for mental illness. And so it would stand to say, well, it should be at least even, but there are reasons for that, and we'll talk about those. And then this final one I always like to throw in, because I think it's an interesting one as we start to talk about how these issues impact people over their lifetime, is percentage of adults over age 65 who needed help with personal care from other people, right? So this idea that once you get to a point of age and debilitation, you need help from somebody else. We see that females are much more likely to ask for and receive that sort of help. Now, this again goes back to sort of our methodology of asking about these sort of things. Is it that men won't ask for help because it's seen as a weakness? And therefore, is this one of the reasons that men don't live as long as women? Women will say like, yeah, I need help and please help me. And men are like, no, I don't need help. And then they keel over and die because they didn't get that help. Those are some pretty big questions that we have to think of, right? When we look at the sort of disparity between men and women's life expectancy, men are not doing so well. They're dying about 8 years before women are. Why is that? Is it because you're not going to the doctor? Is it because you're not asking for help? I don't know, just spitballing some things out here, okay? So what we have is a men's health sort of paradox here. Men have less health coverage and they go to the doctor less, but they're much more likely to have access either through their job or because they make more money. And they're more likely to use it if they actually have to, like in the case of an emergency. If a guy breaks something or cuts himself or other sort of things, they will go and get care taken from the medical world, whereas women will likely go without. And so that's sort of this weird paradox of things. We also know that men engage in riskier behaviors. I always say riskier because everything is a risk. Being alive is a risk. And so risk is a sort of a value-laden word. But what we have judged to be riskier behaviors, smoking, drinking, doing dangerous things, but they also take less advantage of preventative health care. So going to the doctor for checkups, going for screenings, getting vaccines, and all the things that could actually help with those riskier things. And so why do men do this? Why are y'all going and doing the dangerous things and being like YOLO and not taking care of yourself, especially if you have the opportunity to do so? And we know that you will if shit gets like really serious. But why don't you just take more and better care of yourselves, right? And so this comes to this week's sort of question of, is men's health overlooked and something that we don't even think about? Well, yeah, I would argue that it is. And a lot of you wrote this in your reflections this week that, yeah, men's health is overlooked, but it's overlooked by men themselves, right? It's not that we as a society say men are unimportant. It's that men say, yeah, this is not something that we need to deal with. So why is that? Let's take a look and think about that. As I've said before in many of my lectures and other sort of things, I'm a feminist, hardcore feminist. And so feminism's enemy is not men, number one. Feminism's enemy is patriarchy. So what is patriarchy? Patriarchy is a social system in which males hold primary power, males predominate sort of all aspects of life, political leadership, moral authority, social privilege. They control property, and in the domain sort of the family, men are at the head of the family and hold authority over women and children. Do we live in a patriarchy, right? Sometimes people are like, no, everything's like, totally equal now, and men and women, yay, 50%, all that. But I would say if you think that, you really need to look below the surface. In the United States, if we look at sort of the breakdown of political office, right, politics being one of the most important sort of measures of women's participation, Women hold about 17% of the Senate. They hold about 16% of the House of Representatives, far less than 50% if we were talking about a 50-50 sort of breakdown. More, again, if there were other genders included. When we think about state governors, when we think about legislators, when we think about all sorts of things, men are in major power in political sort of leadership. So I would say that's a pretty big sign that we live in a patriarchy, right? Worldwide, when we think about sort of countries in the world, depending on politics, we can say at least 185, sometimes over 200. There's only 14 female heads of state, right? So again, not just in the US, but worldwide, we see a lot of different things where it shows pretty much men are in control. They make the rules. They're the ones who enforce the rules when we look at sort of all levels of government. And then from that flows sort of things like moral authority, social privileges, and all those other sort of things. Let's talk about health specific. When we think about the United States, what percentage of doctors are men? Actually, 66% of doctors are men. We know that women are growing substantially, and we know that that women in medicine is becoming huge. Another thing to look at would be men in leadership roles. So who are the CEOs of hospitals and those sort of things? And that way it's even more skewed. Leadership of men in the fields, whether it be health or others, typically is male dominated and not female dominated. So yes, we are seeing more women doctors, but when we look at who are the people in charge of all those doctors, it's almost always men, right? And so I would say in all aspects, men are the ones in control. If men are making all the political decisions and men are the doctors, why are your health outcomes so gross? That's a big question, right? Well, we have to think about, back to the sort of idea that patriarchy is the enemy of feminism. What was sexism and patriarchy tell us about men, right? Patriarchy says men are supposed to be strong and tough and unemotional, right? Feminists don't say that, but the patriarchy and general sort of ideas about what men should be, that's what the messages are. Men are supposed to take care of women and children, but only in indirect ways, right? By being the man of the house, so you'll go shoot somebody in a physical sort of defense situation, financially, those sort of things. If your wife makes more than you, oh, how shameful, these sort of things. And so you're supposed to take care of the family, but not necessarily in direct care of means, and that's going to be important in a little bit. We have this idea that men are really simple creatures, right? Men care about sex, food, sports, which is totally sexist and really gross. Like, men are whole human beings who care about a lot of things. But if you look at sort of advertising and media messaging and all these other sort of things, men are almost always paired with food, sex, sports, right? Give me my beer, give me my bitch, and give me some basketball or something on TV. And without that, like, what are men? They're just nothing, right? Again, this is what patriarchy says men are all about. Men are challenged to be thrill seekers and risk takers, right? When you see people doing extreme sports, not a surprise, most of it's men, right? People jumping off of buildings, people riding really dangerous sort of vehicles at thousands of miles an hour. Most of those things are done by men, right? Because our society, again, the patriarchal society, says really tough, big, giant, strong men do these really scary, risky sort of things, right? Because it's somehow sexy and awesome to risk your life doing all sorts of things, right? There are lots of others that we have coded into these sort of things. How do these things contribute to poor health outcomes for men? Well, with the risk taking and thrill seeking, that's a pretty obvious one, right? If you fall off your bike going, like 1,000 miles an hour, you're probably going to die, right? If you're jumping off of things or if you're doing things without proper protection, great risk for injuries and death. When we think about sort of men being are supposed to be able to like physically defend their families, well, yeah, that puts people in this sort of position where they're not readily going to sit down and let's talk about these sort of things. They're ready to jump out with their gun and defend their family in their home, rather than thinking about like, hey, maybe I don't need to bring a gun to a knife fight or other sort of things. Financially, we know men don't take time off of work because they're like, no, I've got to be the bread earner. I have to make all the money, and so I can't take time off of work. We know that patriarchy says they're tough and unemotional. Yeah, is it a surprise that suicide rates amongst men are so much higher than suicide rates amongst women? Remember that don't go to seek psychological care for serious mental illness? Yeah, guys don't. Oftentimes they try to say, like, I'm just going to soldier through it, and I'm going to be tough, and I'm going to do all these sort of things, until they're not, right? And then this is why we see when men attempt suicide, they're much more likely to complete it because they don't fuck around. They are like, yeah, this is it. I'm done, and boom, there they go. When men care just about sex, food, and sports, right, where they can't care about anything else, like their health or other sort of things that might bring them joy to their lives. So when we look at these sort of things, doesn't it seem like the main cause of men's health issues is actually sexism and patriarchy, right? As a feminist, I'm a feminist not just for women, although that is very important to me, and not just for other sort of reasons. I'm a feminist for men just as much as I am a feminist for women, right? I think it is a shame and it's awful that we pigeonhole men into these very small boxes and say, men, stay in these boxes, don't do anything else. I think that's really crappy. And I think that all men should be celebrated for all the things that they like in all the ways that they are. And if you do like all those manly sort of things, great, fine, as long as you're making that inherent and conscious sort of choice. And so I think it's a really important sort of thing. And one of the biggest things that I talk about across all of my classes is that feminism is for everybody. Feminism helps to make everybody recognized as a unique individual, that we can care about each individual person, their life, their choices, their health, all of those sort of things. And it's actually patriarchy and masculinity and these sort of things that are the most harmful to men and males, in addition to being harmful to women and other people as well. It's really those sort of things that we need to dismantle. And that's what most feminists believe, is that we need to dismantle these sort of patriarchal ideas and these rigid sort of binary structures of gender, because it's actually hurting everybody, not just women, but it's also hurting men. And sometimes more so, it hurts men, right? So when we look at thinking about how do we get men to take their health seriously, right? This is what we want to do. We want to say, like, hey, go to the doctor, get that health insurance, do the preventative care, stop doing things that put your health at risk, talk about your feelings, all these sort of things. Well, we have some studies that have looked at these sort of things. So the first one I'm going to talk about is a meta-analysis that looked at over 11,000 studies and citations to try and find where are some men's health programs that have been successful. What were they successful at? How did they get men to engage in these sort of things? Unfortunately, the result wasn't so good. The result was, we don't really know. Men will take part in things as much as they will, and it doesn't matter if you spend $100 on marketing to them or $1 to marketing to them. They're going to participate at the same sort of rates. And so one of the reasons that we have women's health or minority health or gender health, other sort of things, is because we know that by doing health at all, men will eventually benefit from that, whether it be because women have told them to go and do that, whether it's because they somehow get caught in the system by accident. What we know is that spending money on male specific sort of health programs doesn't give us a good return on investment. So we don't do it. We invest in other things and know that men will be dragged along and will benefit from those sort of things at the same rate as if we dedicated all of our money to men. That's pretty depressing, right? Like, even if we intentionally try and get men invested in their own health, it pretty much is not worth the investment. That sucks. Stop doing that, okay? Another giant meta-analysis that we looked at is what does work when we do have men invested, and how do we get men involved in these sort of things? What we have found is that using the right setting, so oftentimes outside of statutory services, some of the best programming happens in bars. Some of the other best programming happens in sports facilities. In doing things in a right approach, so drawing on male-specific interests and language, mainly catering to male patriarchal sort of stuff. So talking about penises, right? Like, men, you need to track your prostate because your penis isn't going to work. Oh no, our penis isn't gonna work, how terrible. And oh, look at these boobs. Yeah, see these boobs? Yes, let's come over here and talk about health. And so we do a lot of this weird catering to sort of toxic masculinity to get men interested in their own health. Turns out if we actively listen to men and we can actually get them in there, by reaching them, that actually works, right? But getting them in to be able to listen to them is usually the biggest challenge. And partnering with local groups who have some sort of status. And so being able to work with people who have established these sort of things, which oftentimes relies, again, on these heavy patriarchal sort of stuff. So again, how do we solve this sort of stuff? We know that the root cause of a lot of men's health issues are patriarchy and these ideas that men are tough and all sorts of weird ideas that we have about men. And so we need to stop that. We need to break down the sort of patriarchal system so that we can reach men at a gentle level. But at the same time, we know that the only thing that gets men's attention are these weird patriarchal sort of ideas. And so how do we do this? How do we improve men's health outcomes by saying overall we need to break down all of this patriarchal sort of stuff, but actually the only way to get men's attention is to draw upon those patriarchal sort of things? Those are really opposite ends of the spectrum, and yet those are the two sort of things that we know that we have to do to get men involved. This is why when you think about sort of what's happening in the state of health, we mainly say like we don't know what to do with men, right? So let's focus on women's health, let's focus on minority health, let's focus on LGBTQ health, and we know that at some point men will get into services, right? And so that's where we are currently in time, and this is something that is replicated world over. These things happen in countries all over the world to get these sort of things, right? And so what do we have to do to make this sort of things better? Right now, we really just don't have any idea. We know that women and children will get healthcare and eventually they will get the men in their lives to be able to do it. So we go ahead and we work on women and children's sort of health. How do we get men to empower themselves? We talked about empowerment and women last week, and now we need to talk about men. How do we empower men who already have all the power to get involved and take care of their health? Well, I don't really know how to do those sort of things, but we got to keep working on it, right? At least alerting men and getting them aware of these sort of things, which is why right now you're hearing so much about toxic masculinity and all these other sort of things, because in order to get through those, we have to understand them. We have to be able to talk about them and say, here's where the problems lie. How do we get beyond that? And then how will that impact sort of worldwide, nationwide, all sorts of different sort of things. And so for this week, I'm going to have you delve even more into this area. This week, I'm going to have you watch a documentary called The Mask You Live In. It is from the Representation Project. They have done some other works. One of them is called Misrepresentation, which looks at women's issues and women's representation in media. And they did one specifically on men and male issues called The Mask You Live In. It's available via Canopy, which is a streaming service that you have access to through your university credentials. If you go to the links that they pasted in Canvas, you should be able to get it in there pretty easy access. Canopy happens across a whole bunch of different universities, public libraries, other sort of things. And I want you to watch it. Just watch this documentary and see what you think about it. It is a little over an hour and a half, and then watch it and then reflect on it and think about how does this relate to what we've talked about this week in terms of men's health, and submit that by Sunday. So pretty easy. You just sit back and watch. You don't have to do anything. You don't really have to do any research or sort of busy work. Just watch this documentary and tell me about it. You'll see that on Canvas this week. That's about all for this week. Just a reminder that you're should be working through your drafts of your policy papers. I'm returning the intro papers this week. And if you ever need anything, I'm only an email away. I'm happy to do office hours with you via Zoom. Just set them up at whatever time is convenient for you. Shoot me an email and we'll be happy to chat. All right, thanks. Bye.